Welcome back, everyone. I'm Kelly Meyer with Kelly Meyer Training Solutions, and this session is Key to Individual Accountability. It is an absolute honor and privilege to introduce Dr. Dennis Rudnick, who has more than 25 years of professional experience as an educator, consultant, researcher, administrator, facilitator, program developer, and public speaker on multicultural civil rights and social justice issues. His research includes the relationships between racism, identity, ideology, knowledge construction, and social movements. He is committed to fostering a climate of transformative awareness and understanding through education. He holds a BA in sociology from the University of Mary Washington and a PhD and a Master's of Education in Curriculum and Instruction, Multicultural Education from the University of Washington in Seattle. Dennis Rudnick, PhD, is Associate Professor and Dean's Diversity Fellow in the College of Education at Missouri State University. His approach to the work and his demeanor while delivering the content have left participants not only with an understanding of the material, but how they can apply this knowledge to their own practice and their lives. I am truly honored to work alongside someone with his integrity and substance, and I invite you now, and I ask you to please welcome Dr. Dennis Rudnick. Take it away.
Kelly, thank you so much for that warm introduction. I'm technically an assistant professor, but as someone who makes mistakes all the time, I will not hold that against you. Certainly when you just introduced me with such esteem, I will try and honor your words to the folks here today. Thank you for making the time here today. And your commitment, all of you that are present in terms of doing the work. So let's talk about what we mean by the key to individual accountability. To provide an overview of what we're going to do during our time today is sort of define and operationalize what we mean by individual accountability, and then thinking about the application of that through the lens of cultural agility. We'll talk a bit more about what that concept means, how it's used a little differently in different contexts, and how we ought to consider using it moving forward. And then really tying it to what does it mean to have organizational accountability. And I want to preface our time here by really reflecting on the notion that when we say individual accountability, that we suggest that it is solely on those of us as individuals doing the work, and how unfair that can be, and how unjust that can be, particularly when you and we operate within systems, working with underserved populations, working in many ways we are under-resourced, right? And so I want to just make this claim up front that what we're doing here when we talk about individual accountability is not placing blame on ourselves or on one another or on our organizations, and that's a point that we'll revisit a couple of times through our time here. So let's get into it. Here are a few questions that we're going to attempt to address, and I hope that as I read these questions out and as we go through the rest of our time here, that we can think about and make meaning around what these questions may mean for us as individuals, and then with respect to the organizations and the communities that we work with and serve. So first, as mental health and addiction professionals, what do we mean by individual accountability? Why is individual accountability even necessary to foster our cultural and linguistic competency? What are some concrete, effective practices and strategies for mental health and addiction professionals? How do we do more than just sort of self-diagnose, but what can we actually do? How do we hold ourselves accountable? And how does our individual accountability align with our accountability to our colleagues, to our clients, and to our communities? And then finally, how does individual accountability relate to systemic and/or organizational change? So let's begin by delving into what we mean by individual accountability. What does it require? It requires one to be willing to accept the consequences resulting from your or our choices, actions, or our behaviors, right? And when we say consequences, another way to think about that would be impact. Right? Owning the situations that you have been a part of, that we are a part of, even if we were not the source of said situations, even if we were hired way after the policy or the cultural norm has long, been implemented within your organization. But in order to it be defined as individual accountability, it also requires to do our best to rectify the situations, right? From whatever our sphere of influence actually is. Research has shown that across organizations, including in the fields of mental health and addiction, that accountability is a leading concern. This is true in the public sector. This is true in the private sector, across areas of work life. What is overwhelmingly true is that blame does not solve problems, right? And in fact, can lead to the creation of a negative organizational culture that can really feed on itself, right? It can create a cultural blame where there's no culpability, and we can rely on our morals and our ethics, and that we are doing good work in our own relative sphere, and sort of pick apart the limitations of one another. And many of us may have been in, or perhaps are currently in organizational culture where blame is front and center, and just the way we can probably name a number of ways in which this generates a degree of toxicity. So when we're talking about individual accountability, what we are not talking about is blame. What we are talking about is a space within which employees are empowered to have individual accountability, where we can name that our policies, our practices, our dispositions, our communications with one another, with our clients, with our communities, could use some refreshing, some change, some transformation, and that we're not punished for that. We can be vulnerable and authentic and genuine, and that our efforts to acknowledge and respond to where change is needed for us as individuals, and certainly for our organizations, that those efforts are seen as restorative. Right? So that our organizations take on a constructive approach to learn and move forward from mistakes or missteps. And this encourages individual accountability instead of blame. We might ask ourselves, is that currently the cultural norms and dynamics of the organization that I'm a part of? If so, how? If not, how? And what might we do to shift accordingly? So here are some of the ways in which individual accountability is important. And even if we were to take away the lens of culture and language, right, in a general sense, individual accountability would be important, perhaps even more so when we're thinking about things through the lens of culture and language and difference and power. Individual accountability overwhelmingly shows that it lends itself to developing healthy relationships with our friends, with our colleagues, with our clients, and with our family. Individual accountability lends itself to more positive social interactions. It also lends itself to developing trust within your team and your work environment. How many of us in our personal lives and our professional lives feel more intrinsically motivated to get up every day and be a part of our personal lives and being part of our professional lives, not because things are easy, but because things are honest? Individual accountability can help us generate respect because we know that we mean what we say and we say what we mean. Respect for keeping your word. It also allows ourselves, if we're focusing on problem solving of process, it allows us in the doing of through individual accountability, actually developing our problem solving skills. It also allows for opportunities for promotion in our organization. Right? Seeing ourselves and our roles therein lets the rest of the folks in your organization know that you are someone that cares and is committed to the life of the organization, and there may be, from a self-interest standpoint, some benefit for you to that. Right? It's a place that you want to build with and grow with. I think an important distinction, and just knowing how language operates, that sometimes we use words, replace one word with another, but for our purposes here, I think it's important to make a distinction between responsibility and accountability, right? Responsibility is important, right? We take ownership of our activities. Accountability, on the other hand, says taking ownership of our results. And one way to think about this, if you were given a task, and to sort of see through a community event, right? That's your responsibility. Right? Accountability allows us to think through when things don't go right, and when things do, right? So we're not just checking off the list and saying, well, that was my role and I did it and I just did what I was told, right? Accountability allows for us, encourages us to embrace that we are taking ownership of not just the intention, but the impact of what we did. And it allows us to do so in such a way that we would continuously seek improvement and feedback. So it's this dance between making it about us and not about us. It's the valuing of our intentions in terms of our professional roles, but also recognizing the impact of those roles and being willing to honestly engage with what that is. There are several frameworks and processes and steps when we're thinking through what we mean by individual accountability. But I'd like to touch on three here. First is don't blame. How many of you, and certainly if we address this through the lens of issues of culture, identity, diversity, equity, inclusion, how many of us respond well when we feel that we are blamed? I suspect if I were to look for hands to be raised, not too many of us would go there. Blame or shame or guilt. And it's probably also important to acknowledge, to concretely identify that many of us may have ideas when it comes to issues of culture, language, identity, inclusion, and so forth, that some of us may feel like we are being blamed. If we were to reframe blame to accountability, I wonder how that might shift our perspective and our inclination to do the work, to improve ourselves as individuals and thus our organizations and the communities we serve. And that also helps us reframe what it means to look in the mirror, to not beat ourselves up, to not suggest, well, I wasn't here when that policy was implemented, and I didn't mean to misgender the client or not understand the services that the person was requesting because I didn't know their language that they were speaking in, right? It does instead allow us to think about, well, what is my role in facilitating support of my client or my colleague, right? What perhaps I could look at whatever implicit biases I may hold in a way that is not beating myself up, but is ultimately liberating because I value growing as a person and as a professional, right? And then thirdly, how do we engineer the solution? we're not fixing other people. We're fixing the process. And sometimes that's the communication. Sometimes that's the dissemination of wherever policy is at hand. And many of us, the last, we did a transformation change agency group just a few weeks ago, and a number of folks present were working at large state hospitals. When you're part of a giant organization, and sometimes even when you're part of a small one, we all get into our silos, which can lend itself to not just having full information about what processes are, what policies are, what procedures are, what practices are, but also other folks, because we're not fully engaged with other folks. And this is a prime territory for some of the blame, some of the toxicity that can arise from blame when things don't go quite the way that we would like them to. And so how do we shift in terms of identifying and having a willingness to admit that we can fix the process? What does that look like? It's really important to name that accepting individual accountability requires a lot of courage. I'm in higher education where a lot of folks are required to always be experts and often required to be flexperts. They have to let folks know constantly how much they know. And vulnerability and authenticity are sometimes thrown aside in the interest of knowing things and always being in the right. When we know that, or folks are risk averse, right? They don't want to say the wrong thing. They don't want to cause harm or offense. So how do we acknowledge that it takes a whole lot of courage to accept our own individual accountability, how we might be different, how we might do different. And we know that ultimately, as I stated earlier, this path of courage, although can come with some dips and dives, some detours, will ultimately generate more respect, trust, integrity, and reliability from our colleagues, from our clients, and frankly, from ourselves. I'd like for this to relate to what we've been talking about so far on individual accountability to cultural and linguistic competency, right? I would direct everyone to the Think Cultural Health website, which has a lot of really wonderful resources tied to this topic. And a reminder that cultural and linguistic competency is the capacity for individuals and organizations to work and communicate effectively in cross-cultural situations. This can help improve the quality of the care you deliver to patients from diverse cultural backgrounds and can help improve the quality of the work environment for all constituents, right? It's not pie. Emphasizing and focusing on improving your individual accountability to improving the quality of care for folks from a range of backgrounds that may be different from your own is not at the expense of your clients that may look like you or sound like you. So how do we hold ourselves accountable to perhaps some of our thoughts and perhaps some of our practices? And perhaps, as we'll go to in a minute, some of our organizational policies and procedures that run counter to improving our cultural and linguistic competency and the impact of that process. And just reminding, again, the class standards seek to improve the quality of services provided to all individuals, which will ultimately help reduce health disparities and achieve health equity. And the 2 R's are respect and respond. So respecting the entire individual, right? Who they are as individuals and as members of the communities that they are from. And that respect in action requires our response to their individual health needs and their preferences. So how does our individual accountability align with and affirm whether we are respecting and responding accordingly and appropriately and effectively. So I'd like to tie in what we've talked about so far to the concept of cultural agility. There's a lot of research, a lot of usage on all iterations where you will see culture, culturally responsive, culturally sustaining, cultural competency, cross-cultural, intercultural, multicultural. And just because folks might label a program or a report or a policy or a communication with any iteration of culture, it doesn't necessarily mean that that is what they are doing, right? So I don't want us to get into the weeds about, well, what sort of culture do you mean? I think for our purposes here, we might dichotomize learning versus what we mean here by cultural agility, right? So cross-cultural learning, broadly defined, is really about our competence, we're understanding about, right? We understand that there are different communities, different cultures, different identities, and thinking about ourselves and what cultures we think about and which ones we don't think about, right? So it's really about at that level of diagnosis. Cultural agility is really about knowing how to use our knowledge and to use our cross-cultural learning effectively. That can mean thinking on things like, well, we have an influx of Somali immigrants in our community, so perhaps we ought to think about some of our literature online and printed materials to have those at the ready in some different languages. It could also mean that we are not tokenizing or essentializing members of a community, right? So using it in ways that are effective, right? How do we use our knowledge appropriately, effectively? That's what cultural agility is. There's a couple of ways in which our organizations and we as individuals, through the purpose or the sort of selective use of cultural agility. And again, none of this is to place blame if we're doing things right or wrong. That's really not the point. It's really thinking through, what do we do and when do we do certain things? And does that align in ways that benefit everyone, not just the status quo? So sometimes we could think about cultural agility through cultural adaptation. So that's when we as individuals or we as organizations are adapting one's behaviors to the norms of the context, right? Where it's critical that we change our behaviors. Cultural minimization, on the other hand, is often when one's own cultural norms need to supersede the cultural expectations of others. I'd like to name that oftentimes we may feel that cultural minimization is what's needed, when in fact we are doing a disservice to our organization and our colleagues and our constituents, because that may feel more comfortable for some of us or for most of us, right? The status quo is what we might want to retreat into. Cultural integration is when finding a compromise is actually most important and well worth the effort. It doesn't mean it's easy. There is something about that process, going through that process, and all the courage and all that it requires. To revisiting all of your norms and mores and documentation, what it might look like to actually implement cultural integration. But the point being is to really, you can assess as an organization, and certainly you as an individual, when am I adapting? When am I minimizing? When am I integrating? And what does it all mean? I want to tie this conversation about individual accountability and cultural agility to organizational accountability, because ultimately it's important for us to remind ourselves that this is not about putting the onus, not just the blame, but the onus on us as individuals, right? Certainly those of us that are working in the fields that we are, working for folks that are marginalized and underserved, under-resourced, and you yourselves as an organization may also be marginalized, under-resourced, underserved, right? I'm going to introduce a couple of frameworks that might be useful. One approach is what's called the Cultural Agility Climate Index, or CACI, and it's got 5 dimensions that it looks at. And this approach has looked at like cultural in a more general sense, and then also in the context of globalization. Right? So there's 5 dimensions to consider: your work unit colleagues, your direct supervisors, and your organizational leaders. So these are all through the lens of people or individuals, right? The other 2 dimensions are thinking about it through the lens of organization. So providing the necessary tools and training, right, and how sustained, how committed your organization, how accessible those trainings are, that you're not inadvertently penalized for taking time to go to a professional development event, that you're supported and sometimes compensated. And then what is the overall cultural effectiveness of an organization, right? In general, and then when you have deliberate efforts to improve, say, your diversity, equity, and inclusion efforts, your outreach efforts, your internal support, your recruitment and retention of all of your constituents, all of your colleagues. How effective is it all? Research empirically finds that there's a number of important factors that tend to weigh more than others. One is the role of senior leaders. The confidence that you have as individuals and as a collective in your senior leadership's abilities to lead culturally. That you perceive that your leaders are open to diverse ways of thinking and behaving, and perceive that leaders demonstrate the importance of culture. Most organizations, large and small, have at least one person or at least one unit or area that, and it's all the rage now, having a chief diversity officer or an equity and belonging team, or an inclusion improvement team, or however it is labeled, however it's structured, however it is resourced. And at the end of the day, the ways in which leaders demonstrate and hold themselves accountable and facilitate and foster in not just theoretical but in tangible ways that diversity matters, that culture matters, will lend itself to the structure and culture of your organization, whether or not this is just obligatory, perfunctory stuff, or that you are actually serious and wish to put some teeth and some love behind these concerns. So the role of senior leadership is invaluable. And then secondly, the role of tools and training. When you are provided with the how, or the opportunity to discuss the what and the why. And again, this does not mean that the work is easy or that it is comfortable, but when you have cultivated a space where tools and training are provided, and that all folks are taking part, and that all voices are being heard, this lends itself to significantly more positive feelings about the cultural capabilities of your organization. So this tells us a couple of things about leadership. Leaders have an important role to ensure that team members understand the importance of cultural competence, or however we frame and operationalize culture, and that we have the necessary tools and training to collaborate and communicate effectively. So that's a loving reminder to those of us that are in a role of leadership. Right? Are we modeling? Are we practicing what we're preaching? There's another matrix called the Raci Matrix as an accountability framework. And this is to help us if we are putting together accountability for anything, and certainly including when we are talking about issues of culture or diversity at all. So the Raci Matrix, the acronym is for responsible, accountable, consulted, and informed. And this can allow us to more clearly identify what our various roles are on the project, and also really lends itself to thinking about a shared organizational fate when it comes to accountability. So responsible, again, responsible is we can identify those who are responsible for completing the task at hand. Accountable are those who are ultimately accountable for the completion of the task or deliverable. So again, if you were talking about recruitment and retention of diverse staff, right? We could have a mission statement around that. We could do some marketing around that, some outreach around that, but who's ultimately responsible for looking at what the numbers look like and considerations as to the why or why not? Those that are accountable are also responsible for delegating the work to those who are responsible for completing it. Right? Related, we can think about those that are consulted. This could be subject matter experts on the task at hand. These can be folks that are internal to your organization or external. These are folks that are involved in the specific stage of the project in a consulting or an advisory capacity. And then finally, those that are informed. Those that are kept up to date on progress at each stage of the project. This is usually done in the form of one-way communication, but I want to iterate here that this is quite essential. The more clearly and consistently and authentically more transparent we are in our communication about our processes. We just had a conversation about this at our institution in my College of Education about what our numbers look like for our students, right? And do we sort of make the numbers make ourselves look better, or do we provide this as an opportunity to think about what we can do better and do differently? That requires transparency in the sharing of our information. So how to create a matrix, and I'm not providing a sort of an Excel table here for you, but again, if you find use in this, well, I hope that you do. You would break down whatever your task, your project, or your goal is into all the steps required to achieve it, listing these steps in completion order on the left side of your chart. So you're just making an Excel file. Right? What are all the steps? What are all the things that we're going to do? And then identify every stakeholder working on the task, the project, or the goal, and then list them across the top row. And then you're going to complete the cells for each step, identifying which stakeholder has which role, right? And you can identify the stakeholder by description, by like office or unit, all right? If you want to put something under human resources or leadership or counselor, right? Whatever the roles are, and then identifying who has what roles. And then that allows you, when you are bringing the plan, the task, the project, or goal to fruition, everybody understands what their roles are and their roles relative to one another. Make sure that every task has at least one person responsible for it. I do think, for those of us that have exercised in a previous life, having more than one person for each task can actually be useful. Sort of having a workout partner to make sure that the tasks are being done, that you're holding yourselves accountable. Ensure that for each task, there is no more than one person who's accountable, resolving any conflicts where more than one stakeholder is accountable for a specific task. This helps streamline the work and ensure there's no duplication of work, right? So they might contradict what I said just prior, but in terms of actualizing it, it's going to be whatever your organization needs best. And if sometimes we get caught in the, well, these are the rules, we said that there's only going to be one person, or we say that there's going to be multiple folks to handle a particular task. You have to do what's best for your organization. And the rules are not the thing so much as the process is the thing. I hope that clarifies that conundrum. And then sharing with the entire team. discussing the roles with all stakeholders before beginning the work, and resolve any conflicts or ambiguities at the start of the project. Another framework is MCOD, or Multicultural Organization Development. It's a change process that supports an organization moving from a monocultural or exclusive organization to one that is multicultural, or a diverse, equitable, and inclusive organization. What it doesn't require, and I'm about to talk about what it doesn't require you all to look like the United Nations, right? Many of us are in communities that, at least at first glance, might appear to be monocultural, right? Even though I do want to suggest that diversity and culture mean a lot of things, and not always things that are inherently visible, and that we have depth, breadth, and width in terms of culture and diversity, no matter where we are, right? So it doesn't require necessarily that we are of multicultural, but it does require that we are for. And this requires an honest assessment about where our organization is, a commitment to a vision of where we want to be in the future, and then support of the vision via selection of appropriate goals and interventions. And I'm happy to, during our discussion, provide some more concrete applications of that. But some things that you can do is begin, as an organization, begin to review or analyze your policies, your programs, and services with a lens of inclusion, to really document who are we serving, what groups may we not be serving as well that are in our area. Can you identify 2 to 3 examples of a program, a service, a procedure, or policy that has been intentionally designed to meet the needs of people from different groups? Can you identify 1 or 2 examples of a program, service, or procedure or policy that already exists that you could perhaps improve to better meet the needs of people across a full range of social identity groups? For your hiring processes, right? Do you have sort of transition teams to help folks in? Do you have a mentorship program, right? Because recruitment and retention are 2 different words for a reason. What does your turnover rate look like? Can you assess that and identify what you could perhaps do different? Can you do a self-scan, tying it back to we as individuals? If folks were to observe you for several days, your meetings, your social media, your interactions with your clients, with your colleagues, what might they assume about your commitment to diversity, equity, inclusion, to cultural and linguistic competence? What would they assume that you care about and what you don't? Another strategy is to begin a scan of your units. You're perhaps starting at your desk or your area, or your organization as a whole. What does your physical environment look like? Your decorations, your pamphlets, who is allowed to have photos up of their families and who might not be? Are we, in our efforts to be neutral, still perpetuating certain values about certain cultures mattering and others not, right? And all of this, again, is not to place blame on ourselves or our organizations. It is an honest, authentic assessment that takes courage for that we as individuals and that we ultimately as organizations, through cultural agility, can be better and do better. We can look at our mission, our values, our operations and services. We can look at our leaders and our members. We can ensure that members across all identity groups are full participants in decision making. Going back to those previous slides on when we are doing cultural minimization versus integration, and we're making those decisions as organizations. I wonder if the times in which we are attempting to perpetuate status quo for its own sake, if part of why that continues to happen is perhaps that we are not really thinking about those folks that heretofore and currently have been left out of the conversation, right? That are our best perfunctory stakeholders, right? Whose voices are being heard, whose are not, whose needs are being met, whose are not. And then multicultural organization development also requires that we're actively working in our larger communities. That we are, and I hope that across the time that we're having in this conference and that in general, that you are building bridges, building communication and connections with other folks that are doing similar or the same work across the state of Indiana, across the US, across the world. So in short, multicultural org development entails our strategic actions, our goals, that where we are continually reassessing our current organizational needs, right? That we see that as a value for continuous improvement, where it becomes not just because we have to do this, but it becomes intrinsic to who we are. And we're implementing these strategies. That we are initiating regional efforts to share our best practices, increasing the inclusion in all of our regional institutions, that we're partnering with local and state government leaders, right? That we're not just receiving information from folks that are dictating to us that this is how we operationalize culture and all manner of things, right? And this helps leverage our expertise, that is mental health and addictions professionals, that we know a little bit about what's happening in our field, that what's happening in our communities. That we're staying current on our efforts of our peer institutions and other organizations, that we're conducting regular comprehensive cultural audits. Sometimes that word audit is a doozy. Sometimes folks don't like to hear that they're being audited. I know tax season just wrapped up, right? But again, if this is not to blame or to critique, but to look inward and to just continually assess how we're doing. And sometimes that's having internal folks, sometimes that's having external folks, right? That we see value in that. And then revising our policies, our practices, and norms as needed to maximize inclusion. And that it is an organization-wide effort where we have our folks that individually are accountable to particular tests they're in. Say, let's take a look at our HR policy around harassment, for example. That there are folks that are taking the lead and are responsible and accountable for that work, but it is seen as an organizational-wide value. So that is not just on a piece of paper, but it's actually implemented. And then continue to influence all of your recruiting efforts, and not just with your staff, but with the folks in your communities, right? To work against legacies of mistrust in order to cultivate trust. So we're not just creating, but we are maintaining an equitable and inclusive organization. So this session is titled "The Key to Individual Accountability." All right. Well, which key is it? What is the key? Right. You see lots of keys up here, different doors. Right. We insert the key and we turn it, and then the door locks or unlocks. Right. I'd like to leave us with the thought that perhaps we've been thinking about key in the wrong way. So my son's been playing the piano since he's been 4 years old. That is not him. That's just a stock image. For anyone that plays an instrument, or perhaps even plays the piano, there's different keys, and keys have different roles. And ultimately, these keys are not isolated from one another, right? To make some music, it requires the harmony and the collaboration and the coordination across the entire instrument. And as hokey and corny as that might read, and seem, and feel, I wonder what it might look like if in our process of holding ourselves accountable as individuals, if we saw that reflection and question in alignment with, in cohesion and harmony with, what it means to hold ourselves accountable as an organization. So I will leave you all with that and invite an opportunity for conversation and questions. I do hope that that was useful to you all. Thank you all very much for the opportunity. I did provide some resources based upon the talk, and my contact information is here. Thank you all very much.
Dr. Rudnick, thank you so much. There has been a few questions that have been chatted in, and I want to do a little bit of consolidation because they all stem a little bit around the same topic. And that question is specifically, when we are working in difficult environments, those toxic environments that you discussed earlier, what is the first step towards our reaction and what we can begin to formulate as a response?
So I'll try and address that generally, because that could, I mean, that could mean with perhaps a patient that is violent, or a colleague that is apathetic. We can think of apathy as a form of violence, right? Or as just demonstrative against caring about doing anything in their particular task and job. I think one of the first things that we can do is sort of be proactive and get to know the people in your neighborhood. If you haven't developed trust with folks that would be in the sort of a role of an internal interventionist, sometimes it's HR, right? Unfortunately, human resources in a lot of places has really, and DEI work certainly too, has really been reduced to a compliance mechanism. So identify what your conflict resolution, intervention, policies and stakeholders and sort of accountability folks actually are. And then sometimes folks can be hesitant to do the change because they don't know where to go to. So I think identifying some general spaces for you to do the work, doing some work on implicit bias, on responding to microaggressions when they occur, understand sort of those kind of communication dynamics and how to intervene that supports all folks in that process. And really, as a general strategy, is ask questions. We'd like to think that most people doing the work of mental health and addiction are at heart good, decent humans. We'd like to think so. We'd like to hope so. And so I do want to suggest that sometimes appealing with facts and data doesn't always work, at least not to start. But what we can do is sort of appeal to our ethical and our moral competencies by asking questions, right? Getting folks to the heart of why they may have a different idea or a different view. And it doesn't guarantee necessarily that one person is going to have a complete 180 and will be completely embracing of a desire to make change for themselves or for others, right? We know that change doesn't work that way. But perhaps, at least in the short term and ultimately in the long term, we are interrupting untoward problematic behaviors. And the sea change comes ultimately by recognizing that more and more folks within your organization are doing that work. And being able to model that, please don't use that term. That term has not been used in 20 years, and I'm sorry that you grew up with a particular term, but that's actually not okay. Please don't make fun of that client's accent when they're not in the room anymore, right? So you're leveraging, so again, it's not blaming folks, but it is coming from a space of affirming what is perhaps best in all of us. And so it's not necessarily about changing hearts and minds, but it's affirming hearts and minds. And then obviously if certain colleagues are not willing to change their ways, then you can rely on leadership who have more power to, at the very least, interrupt behaviors to make some hay in a different way, right? And so a related piece would be to have communication, perhaps today, to talk with the leaders of your organizations, or if you are yourself are a leader, how can I communicate that we need to do things a little differently around here, and why? Not because we are being politically correct, but because we are trying to be correct. And I tried to, without knowing the specifics, and I understand that that was kind of an amalgam of lots of questions. I hope that I've given some thought in terms of what you might do.
I think there was
I can certainly say more.
I think there was some fantastic, both tactical actions, reminders that as we as providers are stressed and need that own ability to have a safe space to address concerns and issues, but that we're very human and sometimes we just need to vent, that we do so in a really a positive and productive manner. And sometimes in this space that we work in, it seems like we always have to be so polite or so guarded or so hesitant on our actions, but really it becomes a scenario where as we are more practiced and as we are more intentional, it is part of our behavior and our different roles in patient advocacy versus employee engagement versus community outreach. And I think your very salient points about thinking through what do you need on an individual level in the space, and then take it from there. Some of the questions also resolve around the different frameworks that you've shared. And I think it should be a point of note that you mention often the HR industry, the quote unquote human capital management industry, right? As we in mental health and addictions are really working on the mental wellness and the overall well-being, shouldn't we be the best practitioners also when it comes to the organizational aspects of how we run our organizations? Shouldn't we apply those same tactics? And so I just offer that question to you, Dr. Rudnick, in your experience in different industries, in your continuation of both public health, health equity, and the business work that you're doing. How do we reconcile that? How do we reconcile the service that we provide versus the organizations that we are versus the individual human beings that we are?
Mm-hmm. The old adage, do what I say, not what I do, is quite problematic. And I think you start with the fact recognizing that we don't always say what we do. And just because we're in a role, right? So I've got an 8-year-old, I mentioned him earlier, right? I have the title of father. It's my most important title. But I've got to earn that every single day, and I don't always, honor that role. Practice what I preach in terms of what I esteem to be a good father. So again, when we talk about, and I don't say this to blame, right? I'm a good dad. He doesn't like my jokes, but I suspect a lot of parents deal with that. There's something about thinking about where am I located? What is my role? Perhaps I'm in human resources, or perhaps I oversee the human resources office, or perhaps I've encountered the human resources office before. And I know you just provided that as an example, right? Sometimes we manage people to kind of protect the shield, right? We definitely don't want to make things public because folks might have ideas about our organization, and we're already worried about state funding and all of those kinds of things. How instead might we look at, well, where am I located with respect to this particular issue, right? What are my responsibilities therein? What is my accountability, and where is it not? And then who are the button pushers, right? Who are the actual process changers? And what is my relationship with that person? Can I actually go to my supervisor and have a frank conversation? Could I go to my HR office and talk to them about some challenges that I'm having with a colleague or even a supervisor without fear of retaliation. Right? That is a genuine concern, especially when we're thinking about power across role, across identity dynamics. I think one, and I'm trying to tie this somewhat back to the sort of previous question, is thinking about what it means to be professional. What it means to, and sometimes the language of being a professional or being civil or being respectful can come from a space of compliance or protecting the interests of the organization or individuals therein who hold some degree of power, and not for the purposes of equity or justice or just decency. And so, and particularly even more so when we are talking about being in a field where it's hard and our affect is front and center, and the aggregate tax of the work, even in a perfect world, even if you were adequately and accurately resourced to do your jobs, it's hard work. And so I think reframing what it means to be civil and professional and respectful is perhaps some of the larger conversations, moving to a space of authenticity, that we are not policing our behaviors in the interest of avoidance, and allowing ourselves to have a broader conversation and a deeper conversation, more honest conversation. Why are we having inclusion efforts? Why do we have these roles in our organization? So you can't change the title of your role right away. Now, maybe that's part of what you do. Maybe we think about, do roles, titles need changing, right? Do the descriptions of certain functions need changing, right? That's part of the work. Those are some structural changes. But the real hard work is I think what those two questions are getting at, respectively and collectively. But how do we make some cultural shifts that the actualized descriptions of who we are and what we do in our organization are being more mindful and more responsive to everyone's needs and not just what's written down on a piece of paper? I hope I answered that question. I'm not sure that I did.
There's certainly a lot there to think through, but you certainly answered it, Dr. Rudnick. The context of being able to really understand how each individual's accountability lends to their direct influence and impact on the organization. And that certainly cannot be discounted for any position, and really maximizes the workplace culture if every position accounts for that same significance of that interaction. And so it kind of lends me to think through your earlier slide about the responsibility as intent and accountability as results. And I think if we just really pause on that particular visual to say, and for us each to think through, as Rachel charged us earlier in the leadership address of, as we go through the conference and really take note and really consider what will we be doing 6 months from now that is a direct impact of our responsibility, not only in our position, but then our influence and impact towards our organization, ultimately lending towards a workplace culture that points to individual accountability towards results. I think that's hard work, exhausting work to do on an individual basis if you're showing up and you're the only one doing it. But hopefully through the wisdoms and insights that you've shared with us today and in the conversation with all of our attendees listening, that can be really collaborative and continuing to echo that influence across our organizations widely that participate in the mental health and addictions provider trainings. So thank you so much for your support through the years. And again, another wonderful primer on our focus for this year's conference, our day 1 track of individual accountability and our day 2 track of organizational adaptability, ultimately leading us from the beginning, as you stated 2 years ago, towards inclusion and now towards cultural agility. Dr. Rudnick, thank you again so much for your time and for your support.
Thank you all.
We are now going to turn to another 30-minute break, and I offer those that have not yet had an opportunity to participate in Networking Cafe to please take a look at the top of your email agenda where you have your personalized URL, and underneath is a Networking Cafe section that you can register and then also connect while on the Networking Cafe in the virtual space with your peers and fellow colleagues from across the state. Next up, after our 30-minute break, joining back again at noon, we will be having a fireside chat with our speaker, Jody Ann Burry, who is a speaker, author, podcast host, cancer survivor, and public health expert. And she will be conducting a discussion, sharing her experiences on the intersections of race, culture, and health equity. We're going to go ahead and close the session, and we'll see everyone on the Networking Cafe. Thank you again, Dr. Rudnick.